So newborn babies cry on an average of 133 minutes per day. And like I said before, crying is an essential behavior to communicate what the newborn needs to the mother. It is, however, a very poor signal of what exactly the baby needs. So the current concepts in infantile colic are really important because they affect how the mother deals with the colicky baby. Not only the mother, but the father and the other caregivers, how they interact with the baby. And finally, as it presents to the pediatrician, this is the first time that they would be visiting a healthcare center, and how we interact and how we make them comfortable would affect the entire way in which the mother, the caregiver, and the infant perceive the future healthcare. The brief outline of today, we'll be differentiating a normal cry from a colicky cry, and we'll recollect what we know about colic. We'll look at the incidence, the age distribution. Is there any relation between breastfeeding and colic, and the etiology? Are there any sequelae? Look at the differentials, investigations, and go on to the non-pharmacological management, whether herbal remedies are beneficial or are they harmful? Is there any role of probiotics? We'll be looking at this today. So what is a normal cry? From a meta-analysis of 28 studies of almost 8,000 infants, they found that newborn babies cry more for the first 3 months. And the mean duration of cry is 133 minutes per day during the first 6 weeks. And later, it comes down to around 68 minutes. So colic is a behavioral syndrome of excessive paroxysmal crying. Here, the emphasis is on the word paroxysmal because there is a clear start and a clear end to this cry of a colicky baby. So normally the other babies, normal babies, they cry whenever and whenever they want. But colicky babies, they have a definite time of the day where they behave like this. And what we currently know about colic. So the definition of colic is when a previously normal infant starts crying and that cry lasts for more than 3 hours a day, and it is present for more than 3 days a week, and it should be present for a minimum of 3 weeks at least. So this is the new Rome 4 criteria, and it defines colic. So if you look at the incidence of colic, pediatricians report that almost it's a huge range of 8 to 40%. But when we strictly follow the rule of the thirds, we find that only 35% of infants at any point of their life are suffering from colic. So this is almost 1 out of 3 infants having colic at some point in their life. And if you look at the age distribution, right from 1962, Brazelton et al. Has studied colic, and these 40 years of sleep study have told that colicky babies cry mostly during the first 6 weeks, and the peak incidence is at 6 weeks of age. And if you see the timing of the cry, the colicky babies cry more from 6 p.m. to 12 a.m. So this is the time usually when the pediatrician finishes his OP and he wants to go to bed, or he has already gone to his home and he gets a call saying there's a crying baby there, and you have to go to the emergency or to the OP and see what is happening. So the baby would have been crying right from 6 p.m. But only when the father's sleep is affected at 10, 11 or around that time frame, they will bring running, the baby would come to you. And let us see if there is any relation between breastfeeding and colic. Breastfeeding, we all know, is best for the baby. However, there is a study that found that breastfed infants cry more and sleep less. But like how we saw, not all cry is colic. Probably this cry is because of more hunger and fussiness rather than typical colic. They also found that in bottle-fed babies, the intensity of colic is more, almost 43% more on formula-fed babies. And also in bottle-fed babies, colic incidence occurs earlier, that is at 2 weeks rather than the usual 6 weeks. If you look at the etiology, the word colic is derived from the Greek word kolikos, which means colon. So most of the proposed etiologies have to do something with the large intestine and the GIT. One proposed theory is that aerophagia, that is faulty feeding by the mother, will make the baby take in air, and this air, it causes some discomfort to the baby and the baby is crying. The other proposed etiologies are lactose intolerance, dysbiosis or altered gut flora, immaturity of the enteric nervous system, increased motilin receptors, and finally, cow's milk allergy might also have a role in colic. And if you look at the psychosocial elements to colic, we divide it into issues with the mother, the baby, and the environment. When you look at the mother, the diet of the mother can cause some discomfort to the baby, and a lot of studies are dealing with this. And if you look at the baby point of view, the temperament of the baby, that is, each one of us would be different in our mind outset. Some of us would be jolly, some of us would be serious. So this temperament of the baby is likely to play a role in the colic, and also the family's situation and how they react together as a unit. And depression of the mother early in pregnancy has been found to have been associated with colic, and the depression also in the father. This also is supposed to cause colic in the babies. One thing we don't see in our country is smoking by the mother. If the mother is smoking during pregnancy, or even if she wants to quit smoking and she's using a nicotine patch, it can cause colic in the baby. However, smoking in the father has not been associated with colic. So this is a normal breastfeeding baby. Proper latch is key for everything. And if there is any difficulty in the baby attaching to the breast, if the mouth of the baby is not wide enough to take in the complete areola inside, or if the tongue does not compress the nipple against the hard palate, there is a chance that air can enter into the GIT, and this air can cause gaseousness in the baby and lead to colic. And one thing we remember is also there is a difference between foremilk and hindmilk. We all know that. So if in an infant who is often crying, the mother will keep on feeding that baby. So this lactose-rich foremilk, when it is going into the large colon, there is a possibility that it does not digest and it ferments, releasing gas and can cause colic. I already mentioned that the diet in the mother can have a role. The commonly affected dietary allergens are nuts, seafood, dairy, and wheat. And if you suspect that a particular food in the mother is causing colic in the baby, you can stop that particular diet for 2 weeks and you can see if the symptoms resolve. And we'll go to the next part, that is the gut microbiome. So when a baby is born by a normal vaginal delivery, the baby is getting the normal probiotics from the vaginal valve of the mother. And these will in turn inhabit the gut of the baby. The other way is that the baby swallows the bacteria from the mother's nipples, and these will colonize the baby's DIT. Of special interest is the lactobacilli and bifidobacteria, which are called as probiotics, and these play a very important role in the microbiome of the baby. So these microbiota will colonize the gut epithelium other to the gut villi, and it will prevent the harmful pathogens from attacking the GI walls. And this helps the baby prevents it from a lot of diseases. They found, DeVere et al. Did a study, a longitudinal study that found that in the stool samples of babies who have colic, there is a very slowly development of the microbiota. Especially the harmful bacteria like Proteobacteria and Klebsiella are increased in the stool samples of colicky babies, whereas healthy bacteria like Bifidobacteria and Lactobacilli are reduced in the colicky babies' stool samples. And they also found that when they tested this stool sample of colicky babies, the fecal calprotectin level is almost twice as that of a normal infant. So fecal calprotectin is taken as a surrogate marker of gut inflammation, and this gut inflammation can affect the fecal osmolarity, the pH, and the luminal nutrients, thereby affecting the entire microbiome. How can we measure crying? So it is a very subjective thing, crying. So usually the mother is given a diary like a baby day diary or the Ames cry score, and normal questionnaires are available online like the Rome 4 pediatric questionnaire, which the mother can fill and she can bring it during review. So these are columns where the time is shaded and when the baby is sleeping, when the baby is awake, etc. And the mother will shade the appropriate timing and she'll bring it to you. And you can know how long the baby is crying. When you go to the history, a particularly important one is the criteria of colic should be satisfied. The timing, that is in the evening hours, and the age. Any newborn baby with crying should not be labeled as colic. So usually it is around after 6 weeks of age. And we have to ask about the infant's feeding, stooling, and urination to see if the baby is not hungry and crying. And the sleeping patterns can be assessed. And you make the baby interact with the mother and check that. And an important history is a negative history of fall, a fever, or a seizure, or a vaccination, which can be a reason for the crying and not colic. And when you plot the growth chart, you will find that these babies are usually large. They have accelerated growth because the mother keeps on feeding the baby as she is crying. And a baby with failure to thrive and colic does not happen. There is some other organic cause for the crying. So a typical cry is paroxysmal, like I already said, and there is a difference in the tone of the cry. It is high pitched, and the mother says it is irritating and really painful for her. And there will be hypertonia with facial flushing, and the baby will have difficulty consoling. So whatever you do, you cannot prevent the baby from crying, and whatever you do, you cannot stop the baby from crying either. On examination, we have to specially assess the hydration and subcutaneous fat to rule out that the baby is not hungry and the baby is well fed. Then we can assess for any tongue tie which might interfere with feeding in the baby, and a head-to-toe examination to rule out the common differentials. So colic is a diagnosis of exclusion, and only after we satisfy all the other, we have ruled out everything, we'll come to a diagnosis of colic. The common differentials would be reflex, gastroesophageal reflex, a corneal abrasion which can be checked with a fluorescent staining of the cornea, a hair tourniquet, usually the hair from the mother's hair, can be tied around a finger and it can cause incessant cry. If in a male baby, you have to rule out torsion of testis, big hernias, meningitis, which is a reason for high-pitched cry, intussusception, ear infections, and urinary tract infections. This is the number one lab investigation, if at all you have to do. Please do a urine routine and a urine culture to rule out UTI in a crying infant. Any diaper rash, any oral ulcers, and finally any history of fall that can cause a fracture in the baby, and child abuse. Here we can see the typical burnt mark of a cigarette. So child abuse should also be ruled out. Lab tests have limited role, if any. If you suspect lactose intolerance, you can do a stool reducing substance test. And for cow's milk protein allergy, you can do a knuckle blood test. Fecal calprotectin is a research tool, and reflex studies if you suspect GRD. Colic does not have major long-term benefits, effects. It is self-limiting and it is benign. However, there are studies that say there is an increased susceptibility to recurrent abdominal pain, eating disorders later in life. They also have a positive influence on migraine without aura. These babies can have migraine later in life. And the effects of colic on family functioning are present early, but they stop after 3 years. There were studies that said that colic is associated with atopy, eczema, allergy, etc. But these studies have been refuted now. And temper tantrums are found to occur in babies with colic at the age of 5 years. So commonly we would see babies like this behaving in the shopping mall when you don't buy them anything. So a temper tantrum is an unpleasant, disruptive behavior in response to an unmet need. When the child does not get a chocolate or a toy, he starts crying. So colicky babies have temper tantrums later in life. And the sleep pattern is affected in colicky babies. They have a shorter sleep time. They wake up easier, and arousals are also more in colicky babies. And if you do a sleep study, you will find that the babies with colic had obstructive apneas during REM sleep at 2 months of age. And it is very stressful for the parents rather than for the baby. It can be a cause for postpartum depression in the mother. The mother can stop breastfeeding thinking that something is wrong with her breast milk. She can have guilt, exhaustion, anger, etc. And it can also lead to shaken baby, where the mother is frustrated and she shakes the baby to stop it from crying. This can cause hemorrhages in the brain, and the mother should be counseled so she does not resort to such techniques. The non-pharmacological management, remember the 5S technique, swaddling, that is wrapping the baby like a package, and you should teach it to the second caregiver, not the mother, because the mother is already stressed. She cannot handle much. So you can ask the grandparent or the father to do this. And the other ways are making the baby sleep on the side or stomach, making shh sounds, shh, and all the types, gently swinging it back and forth, and making the baby suckle on the breast or a pacifier. And the other thing is teach the proper burping technique so that the baby's gas gets released. Massage has been tried with some success in the Western world, and even our parties do this massage with oil. And there are things available that you can buy, like a rocking chair for the parent who is not able to comfort it. It will take some time off the mother also. Acupuncture has been studied, and there are studies which say that it is helpful, but further research is needed. We all know this ad. We would have seen it as a kid. Enna aachu குழந்தை அழுகிறது, Woodward's cry water கொடு, நான் குழந்தையா இருக்கிறச்சு அதான் கொடுத்தேன். So this is the herbal remedy which all of us use, or we would have come across a prescription by a senior or a junior pediatrician. And the Woodward's gripe water is very familiar to men like us because it resembles a water bottle. Earlier formulas had alcohol. What it has now is not alcohol, but it has dill oil and sodium bicarbonate. There are studies which say that gripe water administration is not at all beneficial, and it can cause vomiting, constipation, even colic itself. It also has preservatives which are not given for the baby usually. And Bonison is again a very common drug which we come across in prescriptions. This contains fennel seed oil. There are studies which say that fennel seed oil emulsion is superior to placebo. However, this again contains preservatives. And the latest therapy is available in Amazon. You might be wondering what it is. It is called Ura Marundu. It is available as a package on Amazon. It has Vasambu, Kadikkai, Masikai, Sukku, and Manjal, and it comes with this beautiful kal called the Varakal. This is the procedure in which the mother is supposed to make that. She has to burn all the ingredients in Velakanna. Then she will express a little bit of breast milk and grind that thing on the breast milk. And you get this beautiful, viscous, black, dirty liquid, which the mother will feed every time, or the grandmother will feed every time during bath. It supposedly helps in digestion. And once we know how it is made, I definitely would think none of us would recommend this. So dicyclomine is one weapon in our arsenal. It does have benefit. It can cause smooth muscle relaxation. However, it is associated with a lot of side effects like anticholinergic, dry mouth symptoms, etc. It can cause a drugged, dopey look in the baby and can cause apnea, seizures, and syncope. So we generally do not advise this. Proton pump inhibitors, none of the associations like the North Indian or the European Pediatric Gastroenterology, Hepatology, and Nutrition Society advise this. Until and unless GRD is proven, there is no role for PPI. Lactase, no benefit. Simethicone, which is a very favorite drug of ours. So supposedly what it does, it causes the gas bubbles to coalesce and it releases the gas and expels it. However, 2 high-quality studies done in 2016 found that these have no benefit in colic. It is considered to be safe. You can just give, no harm in that. Remember one thing, it can interact with levothyroxine, and if the baby is supplemented with levothyroxine for congenital hypothyroidism, this will decrease the levels in blood. So we have to remember this point alone. And the latest in research is probiotics like Lactobacillus reuteri, which is found in every part of the human being, from the vagina to the human milk. What is proposed is Lactobacillus reuteri alters the gut microbiota. It increases healthy bacteria counts and reduces harmful bacteria levels, thereby reducing crying. And there was a study done by Savina et al. Who found that there were more beneficial bacteria and less harmful bacteria in babies' stool samples who are given Lactobacillus reuteri, DSM 17938. Lactobacillus reuteri does reduce crying time by almost 50%. And by 28 days of supplementation, they found that crying from 4 hours per day dropped to 1 hour per day. And this was continuing, the benefit continued even after stopping that molecule. But a systematic review finds that Lactobacillus reuteri reduces crying only in breastfed babies and not in formula-fed babies. And there is a huge but inconsistent variation, and it appears to vary geographically, probably because the microbiome of a mother from India would vary from that of USA. So there are a lot of limitations in these studies also. They were done in a highly selective group, and further research is needed to clarify whether we can give for all colicky babies. Other species that have been tried are Lactobacillus rhamnosus, which not only reduces crying and fecal calprotectin, but the side effect is that it increases the total bacteria levels, not only the healthy bacteria levels. So if you suspect cow's milk allergy, if the baby is breastfed exclusively, take the mother, counsel her, and ask her to stop any suspected allergens in her diet. If the baby is given a mixed diet, you tell the mother she should only give breastfed and not give any other diet. But if it is a formula-fed baby, you can give extensively hydrolyzed formula such as Alimentum, Nutraminogen, etc., which are available online also. And these hydrolyzed formulas do have a role in cow's milk allergy. Soy-based formulas, they are never recommended for anybody less than 6 months of age. So, and again, research from Vanderplas et al. Says that fermented formula, the lactose is fermented to glucose, galactose, and they add oligosaccharides like prebiotics like the galacto-oligosaccharides and fructo-oligosaccharides. They found that when they did this trial, they found that colic was less in babies given this experimental formula. And the crux of therapy is only counseling. You can see the mother bringing the baby to you. She's sad, she's upset, she's angry, she's violent. You sit and counsel her. Remember PURPLE, PURPLE. You tell the mother that a baby will have a peak of crying. So it will cry initially more for the first 6 weeks and gradually it will drop. You tell that the cry will be unexpected. You cannot stop it. You cannot prevent it. You cannot cure it. You tell that the baby will resist soothing. Whatever they do, the baby will continue crying, but they do not worry. You tell that the baby will have a pain-like face, but the baby does not have real pain. Though it looks as if it is in pain, it does not have real pain. You tell that the baby's cry would be long-lasting, that is even 5 hours per day, and you tell her that it is more in the evenings. So this is normal colic. You don't be sad. You don't get frustrated. Give your baby to the second caregiver. You take some time off. You make sure that she is confident enough to deal a baby. Don't burden her with unnecessary things. And at the end of the session, the mother should go home like this, happy and confident, not only in herself, but also in you. And remember, breastfeeding is the birthright of every newborn baby. It should be given exclusively for the first 6 months of age. There is no other, nothing that compares to it, this liquid gold. So summing up, we saw that not all cry is colic. We saw that we have to exclude the differentials before you label it as colic. And then we saw we have to avoid herbals and other unnecessary medications. Probiotics are promising. There is need for more research in this field. And finally, reassure the mother. Make sure that she leaves your clinic happy. Thank you.